Hello.
Yeah, okay, sir. Good evening, all. I'm doing second year postgraduate microbiology, SV Medical College, Tirupati. My paper topic is bacterial spectrum and their antibiogram among sputum samples during COVID-19 pandemic at a tertiary care hospital. Yeah. Coming to topics, first introduction, aim, objectives, material and methods, results, discussion, conclusion, limitations, and references. Then coming to introduction, respiratory tract infections are the most common infections of human beings. Lower respiratory tract infections are among the frequently reported infectious diseases of humans worldwide. Respiratory viral infections may alter innate immune function in affected pulmonary tissue, thereby promoting bacterial growth. Following viral infections, altered epithelial cells that disrupt the mucociliary clearance and mucous thickening, impairing the movement of immune cells. In particular setting of SARS-CoV-2 infection, fluid and pus-filled pulmonary alveoli create a nutritive environment for bacteria such as Pseudomonas aeruginosa and Staphylococcus aureus. Coming to aim, this study is conducted to determine the bacterial spectrum and antibiotic pattern from the sputum samples during COVID-19 pandemic at a tertiary care hospital. Then coming to objectives, the first one, to determine the bacterial spectrum from sputum samples and to study the antimicrobial sensitivity pattern of the bacterial isolates. Method. This cross-sectional study was conducted from January 2021 to June 2021. Department of Microbiology, Sri Venkateswara Medical College, Tirupati. Sputum samples received from various clinical departments. Then processing of the samples was done according to standard guidelines. Then coming to direct gram staining, culture on blood agar and McConkey agar. Then isolates were identified by appropriate biochemical reactions. Antimicrobial susceptibility testing was done by Kirby-Bayer disk diffusion method. Using oxygen 30 microgram, methicillin resistant in Staphylococcus aureus was determined. Using ceftriaxone 30 microgram, astrianon 30 microgram, and ceftazidime clavulanate, ESBL producing Enterobacteriaceae were detected. Results, a total of 382 sputum specimens were collected during the study period, out of which 74% were from males and 24% were from females. Among 382 specimens, 218, that to 57% were culture positive. Then gender-wise distribution of specimens, total specimens were 284 and gram-positive bacilli were 72, gram-negative bacilli were 59. And coming to female, total female specimens 98. Under that, gram-positive bacilli were 40, gram-negative bacilli were 37. And age-wise distribution of the study, the isolates, the bacterial isolates, Streptococci pneumoniae was isolated. The age was 46 to 65 years maximum. The Staphylococcus aureus were 46 to 65 years. Then Klebsiella pneumonia 46 to 55. And Acinetobacter 26 to 35 years age. And Pseudomonas 56 to 65 age. And E. coli is maximum 36 to 55 years. And Proteus coming to age 46 to 55 years. And Moraxella 36 to 45 years. And frequency of isolates, the total number 218, the percentage of gram-positive bacilli is 51%, gram-negative bacilli are 44%, then another 5% is Candida. Then distribution of isolates by gender. The bacterial isolates more in male persons than females. Then Streptococcus pneumoniae in males 63 and females 33%. Then sensitivity pattern of gram-positive bacterial isolates. The Streptococcus pneumoniae 100% sensitivity cefeparagon and sulbactam, Staph aureus, vancomycin. Then Streptococcus pneumoniae least sensitive to penicillin, Staph aureus, penicillin least sensitive. Then sensitivity pattern of gram-negative bacterial isolates. Klebsiella pneumoniae more sensitive, cefeparagon, sulbactam, imipenem. Then according to all bacterial isolates, gram-negative isolates is more sensitive, cefeparagon, sulbactam, and imipenem. Frequency of drug-resistant isolates, methicillin-resistant Staph aureus, that is total number 16 we isolated, then frequency methicillin-resistant Staph aureus is 19%. Then ESBL producing Klebsiella pneumoniae is 11% out of 53. And coming to discussion, in the present study, 382 sputum samples were collected and processed, among which 208 samples showed culture positivity. The age group predominantly affected in the present study is 56 to 65 years, that is 22%, which correlates with the study conducted by Fee He et al. 43%. The males, 60% males were more predominantly affected compared to females in the present study. This correlates with the study by Fee et al. 54% and Salman Khan et al. 28%. Among the 218 culture positive isolates, Streptococcus pneumoniae 44% was predominant in the present study, which is similar to the study by Salman Khan et al. 52%. Among the gram-negative bacteria, Klebsiella pneumoniae 24% was predominant in the present study, which coincides with the study conducted by Ulaf Borkot et al. 8%. Among the gram-positive bacteria, highest sensitivity was seen towards cefeparagon, sulbactam 100% and least sensitivity to penicillin. Among the gram-negative bacteria isolates, highest sensitivity were noted towards ceftriaxone 85%, cefeparagon, sulbactam 93% and amikacin. This correlates with the study conducted by Salman Khan et al. The ESBL producing Enterobacteriaceae isolates were 100% sensitive to amoxicillin, clavulanate, but the susceptibility to ceftriaxone 94% and aztreonam 90%. This correlated with the study by Dinesh Kumar et al. Coming to limitations, the genotyping study of the MRSA isolates and ESBL producing Enterobacteriaceae organisms were not done in the present study. Conclusion: as there is raised prevalence of multi-drug resistant organisms among the clinical isolates, it is mandatory to perform culture and antimicrobial sensitivity testing before initiation of antibiotics. This can be achieved by implementing appropriate antimicrobial stewardship program in the hospital settings. These two slides references. Thank you.